Hello, I'm Ryan Zimmerman, Managing Director and Medical Technology Analyst here at BTIG. We're excited to be here at the Innovators Pop-Up. In the hot seat with me is Robert Chang, President and CEO of Myra Vision. Robert, thanks for joining us.
Thank you. Glad to be here.
So let's just talk a little bit about what you're trying to solve with Myra Vision.
So with Myra, we're really trying to help really the number one cause of irreversible blindness in the world, which is glaucoma. And there's about 80 million people in the world that have glaucoma and suffer from vision loss. So we're really targeting those patients that are surgical candidates, and it's sort of in the category where they've already lost some vision and are projected to lose more.
And what's the early experience been with the technology from the physicians that have gotten to use it?
So our technology is really, we call it the Calibri system, and it's the Calibri titratable glaucoma therapy surgical system. So a little bit of a long word, but we call it the Calibri TGT surgical system. But again, really targeting the surgical patients. And what our difference from everybody else is that we can titrate the flow after the device is put in. So we sort of think about today's glaucoma therapies, which are all good therapies and they're effective, but it's sort of like driving a car without brakes. So you can't really adjust to any surprises that come up. With our system, we're hoping to give the physician bring them to the modern car stage where as they're navigating, they can increase or decrease the IOP with a simple office-based visit for that patient. And we think really it'll personalize care for those patients. So in terms of your question about sort of where the KOLs are today, it's like we've had really good interactions. We have a core group that we've worked with, and they have enjoyed working with us and helped us to get it to this stage. We're now in the clinical trial where we're doing a feasibility trial. The nice thing about the trial is we've actually demonstrated that the device works. So when we open up a valve in our system, we'll see the IOP decrease. If we close a valve, we'll see the IOP increase. So we know the device is working as designed, which we're happy with to see that. Now we're waiting for longer term data. So KOLs are super excited about it.
And MIGS is a very crowded space, minimally invasive glaucoma surgery. Why does titratable outflow make sense for patients and for physicians?
Yeah, so I think first off, I think we don't really consider ourselves a MIGS device because a lot of the MIGS devices are for patients who haven't lost vision yet. So we're really a little bit more upstream of that for patients who have lost vision already. But in all the categories of glaucoma therapy, the devices out there, or we term them as passive flow devices, meaning that there's no adjustment. You put them in, you hope they work. And if they don't work, then you put another device in or look at another therapy. So with our device, you can really titrate the flow and get it personalized for each patient. So you can really target it for that individual patient depending on their anatomy, how their disease progresses. So we really think that's a big differentiator for us.
Okay. And where's the company at in terms of regulatory, clinical, or commercial, in terms of just timelines and expectations?
Yeah. So we're part of ShifaMed, which is an innovation hub. So that's been very fortunate for us in that we've been able to sort of leverage some of that and move things along very quickly. So we're now in the clinical trial. We've done all the preclinical work, lots of animal studies, lots of bench tests and evaluations. So we're now in our feasibility trial where we've treated over 30 patients. We're excited about those results. We don't have long-term results quite yet, but we'll be releasing those in the next few months as we gather a little bit more data. But again, we know the device is working the way we designed it because we can see when we adjust our device, and we can see the IOP go up and down depending on what the physician wants to do. So we've sort of gone the first rung of the clinical ladder, I would say. Regulatory-wise, we're looking to get in the U.S. market first, which is the biggest market in the world. So hopefully we'll be starting a trial in the U.S. next year. And then beyond that, we'll be looking at CE mark and sort of maybe a little bit behind the FDA. But with the new MDR, we're sort of trying to understand how that's going to work for us. But around that time frame would be where we're at.
And just lastly, what's the next catalyst we should be on the lookout for from Myra Vision?
I think the next, I'd say in the short term, the biggest catalyst will be our longer term data with our device, which again will be next few months, say next 6 months or so, we'll be able to release that at some of the scientific meetings. So I think that's going to be exciting for us to, we haven't seen it yet, so I think it'll be exciting for us to see it and then release it to the rest of the world. And then after that, we'll be starting a US trial. That's probably in the, I'd say middle term, and then beyond that will be commercialization.
Well, Rob, I want to thank you for joining us in the hot seat at the Innovators Pop-Up. I'm Ryan Zimmerman from BTIG, and we appreciate you participating. Thank you.
Yeah, thank you.
Thank you.